In this chapter, we're going to talk about the principles of oxygen therapy. Pure discretion is advised. Some slides may have visual effects that aren't always suitable for all audiences. We use the Emergency Medical Responder First on Scene for our Emergency Medical Responder course. We do not get paid to use this book. However, over the years, this course has been the easiest for our students to comprehend, therefore is why we utilize it. This work is protected by the United States copyright laws and is provided solely for the use of our instructors to teach courses and assess the student learning process. The content on this website has been made available for our instructors to copy and distribute to our students in any classes as we see necessary. All education provided is a guideline to help you learn new concepts to better treat your patients. Your local protocols supersede any education you learned in this course. You must always review with your medical director before changing your treatment plans that are outside of your local protocol. Some objectives we're going to talk about is defining the following terms: humidifier, hydrostatic test, liter flow, nasal cannula, non-rebreather mask, and O-ring. You will be able to define oxygen concentration, oxygen supply tubing, pin index safety system, pressure gauge, pressure regulator, reservoir bag, and supplemental oxygen. Explain the benefits of supplemental oxygen. Explain the indications for supplemental oxygen. Differentiate among the common sizes of oxygen cylinders used in EMS, and describe the potential hazards of working with high pressure cylinders. Explain safe practices when working with high pressure cylinders. Describe the purpose and function of an oxygen regulator. Explain the indications for the use of nasal cannula, and explain the indication for the use of a non-rebreather mask. Demonstrate the proper use of a non-rebreather mask. Demonstrate the proper use of a nasal cannula. Demonstrate the ability to add supplemental oxygen to a pocket mask and/or a bag mask device. Demonstrate the proper technique for attaching a regulator to a cylinder. Demonstrate the ability to identify and troubleshoot a leaky oxygen cylinder regulator, and recognize the value that supplemental oxygen might offer for most ill and injured patients. In this section, we're going to talk about the importance of oxygen. Oxygen is a drug. Oxygen concentration is the amount being delivered to the patient. That's the air that we breathe that contains 21% oxygen. Supplemental oxygen is at 100%. Patients may need supplemental oxygen for respiratory or cardiac compromise, cardiac arrest, shock, major blood loss, injury to the lungs or the chest, airway obstruction, and stroke. Other signs that patients may need oxygen can be altered mental status. The brain is one of the first organs to suffer when there is not enough oxygen. Changes in mental status such as anxiety, restlessness, drowsiness, confusion, and unresponsiveness are all indications of a serious underlying problem. The next one is abnormal vital signs. Abnormal changes to what would otherwise be normal vital signs such as low blood pressure, rapid pulse, rapid breathing, and poor skin, which is the pale, cool, and moist, may be indications of an underlying problem. Next is significant mechanism of injury, or also known as an MOI. Any individual who has had a significant injury, regardless of an open wound or not, may have sustained damage to the circulatory system, resulting in a disruption in normal blood flow to the vital organs. And last, the increased level of distress. This refers to anyone who appears to be in significant distress as indicated by difficulty breathing or significant pain. In this section, we're going to talk about oxygen saturation. Current American Heart Association guidelines recommends that oxygen delivery be monitored and adjusted to obtain an oxygen saturation of greater than 94%. The ability to monitor a patient's oxygen saturation is accomplished by using a device called a pulse oximeter. Your agency or unit may not carry this device. For more information on pulse oximeters and what they do, you want to look at the Appendix 1 at the end of this book. In this next section, we're going to talk about the hazards of oxygen cylinders. Certain hazards are associated with oxygen administration. They include the following. Oxygen used in emergency care is stored under pressure. They have 2,000 pounds per square inch or psi or greater. If the tank is punctured or if the valve breaks off, the supply tank and the valve can become projectiles, injuring anybody nearby. Oxygen supports combustion and causes fire to burn more rapidly. Oxygen and oil do not mix. When they come into contact with one another, there can be a severe reaction which may in turn cause an explosion. In this section, we're going to talk about oxygen therapy equipment. A typical oxygen delivery system includes an oxygen source, which is the oxygen cylinder, a regulator, and a delivery device. Occasionally, there's a humidifier that will be added to provide moisture to the oxygen if the patient will be on the system for an extended period of time. The oxygen cylinders, when providing oxygen in the field, the standard source of oxygen is a seamless steel or aluminum cylinder filled with pressurized oxygen. The maximum service pressure is equal to approximately 2,000 psi. Cylinders come in various sizes, and each is identified by a specific letter. The common sizes that are practical for the emergency medical responder include the Jumbo D cylinder, which contains about 640 liters of oxygen. Next is the D cylinder, which contains about 425 liters of oxygen, and then the E cylinder, which contains about 680 liters of oxygen. Part of your duty as an emergency medical responder is to make certain that oxygen cylinders are full and ready to use before they are needed for the patient care. The amount of oxygen in a cylinder is expressed in per pounds per inch or psi of pressure. In most cases, you will use a pressure gauge to determine the pressure remaining in the tank. The pressure gauge is located directly on the pressure regulator and will display the actual pressure inside the tank. A cylinder is considered full at 2,000 psi, half full at 1,000 psi, and a quarter full at 500 psi. The length of time that you use the oxygen cylinder depends on the pressure in the cylinder and the flow rate being delivered to the patient. Each size of oxygen cylinder has a predefined conversion factor that is used to help determine the duration of oxygen for a given situation. These are the components of a typical oxygen delivery system: the oxygen regulator, cylinder, mask, and cannula. Again, the oxygen cylinders come in various sizes identified by the letters: the D cylinder, the Jumbo D cylinder, and the E cylinder. Here are various sizes of portable oxygen cylinders. From the left to the right is the Jumbo D, the Standard D, and then the E. Pressure gauge determines pressure remaining in the tank. Never allow to go completely empty, and never allow pressure in the oxygen cylinder to fall below 200 psi. While all oxygen systems are designed with safety in mind, there are several tips that you should be aware of when working with them. The following are some general guidelines to keep in mind when working with high pressure cylinders. Never allow smoking. Never use around open flames or sparks. Never use grease or oil, and never put tape on the cylinder. Never store near high heat or in a closed vehicle parked in the sun. Keep portable cylinders lying flat. Use pressure gauges and regulators. Ensure O-rings are in good working condition. Valves connections should only be hand tight only. Open and close all the valves very slowly. Store in a cool, ventilated room and have them hydrostatically tested. The pressure in a full oxygen cylinder is approximately 2,000 psi. This is much too high of pressure to be used directly from the cylinder. A specialized regulator, called a pressure regulator or oxygen regulator, must be connected to the oxygen cylinder before it may be used to efficiently deliver oxygen to the patient. All oxygen regulators have a minimum of 3 functions. First is reduce the tank pressure. The first function of the regulator is to regulate or reduce the pressure of the oxygen leaving the tank to allow for efficient delivery to the patient. It can reduce the pressure from 2000 psi to between 30 and 70 psi. Next is display the tank pressure. The second function of the regulator is to display the pressure contained inside the cylinder. It does so by the way of the pressure gauge. So the gauge displays the actual or the unregulated pressure remaining inside of that tank, which is a direct indication of how much oxygen you have left in that tank. And then last is the control of the delivery of the oxygen. So the third function of most regulators is the leader flow valve, sometimes called that flow meter. The leader flow valve is an adjustable dial on the regulator that allows you to select a specific flow of oxygen to the patient in liters per minute. An oxygen delivery device such as a mask can be connected to the leader flow valve. Then when it is placed on the patient, it then can be delivered the selected flow of the supplemental oxygen. Here is an example of some pressure regulators. You've got one that is on the tank and one that is off the tank. On portable oxygen cylinders, a yoke assembly is used to secure the regulator to the cylinder valve's assembly. The yoke has pins that must mate with the corresponding holes found in the valve assembly on the cylinder. This is called a pin index safety system. The position of the pins varies for different gases to prevent an oxygen delivery system from being connected to the cylinder containing other gases. There are 3 pins on the regulator that must match the 3 holes on the oxygen tank. The largest pin is the oxygen port. This pin is the pathway through which oxygen flows from the cylinder to the regulator. The 2 other pins serve as the means to properly align the regulator onto the yoke. Before placing the regulator onto the yoke, you must ensure the presence of an O-ring. The O-ring sits over the oxygen port and serves as a gasket to ensure an airtight seal between the regulator and the cylinder valve. Here you will see the Pin Index Safety System, or the PISS, and it's got the presence of the O-ring as indicated by that blue arrow. A humidifier is an unbreakable container of sterile water that can be placed in line between the flow valve and the oxygen delivery system. As the oxygen from the cylinder passes through the water, it picks up moisture from that water. In turn, the oxygen becomes more comfortable for the patient to breathe. Non-humidified oxygen delivered to a patient over a long period of time, which is usually more than 20 minutes, will actually dry out the mucous membranes and passages of the upper airway. For the short period of time in which the patient receives oxygen in the field, this is usually not a problem. You will encounter 2 types of patients who may need supplemental oxygen: those who are breathing on their own and moving air adequately, and those who are breathing inadequately or not at all. So there are 2 different devices that are used by the emergency medical responder to help deliver oxygen to patients who are breathing on their own. The first one is the nasal cannula, and the second is the non-rebreather mask. Those are the 2 main oxygen delivery devices used in the field administration of oxygen to breathing patients. So first is the nasal cannula. It delivers oxygen into the patient's nostrils by way of 2 small plastic prongs. The nasal injuries, colds, and other types of nasal airway obstruction greatly reduce its efficiency. A nasal cannula has an effective flow rate of between 1 and 6 liters per minute. These flow rates will provide the patient with an increased oxygen concentration between 25% at 1 liter per minute and 45% at 6 liters per minute. The approximate relationship of oxygen concentration to liters per minute flow is 4% oxygen concentration per liter of flow. So that means for every 1 liter per minute increase in oxygen flow, you deliver an approximate 4% increase in the concentration of oxygen. So for instance, at 1 liter per minute, you are getting 25% concentration. At 4 liters per minute and above, the patient's breathing pattern may prevent the delivery from the stated percentage. At 5 liters per minute, drying of the nasal membranes is likely. And above 6 liters per minute, the device does not deliver any higher oxygen concentration of oxygen and may be uncomfortable for most patients. Next is the non-rebreather mask. The non-rebreather mask is used when the patient requires a higher concentration of oxygen other than what the nasal cannula can deliver. The non-rebreather mask consists of a face mask, a one-way valve, and a reservoir bag. The reservoir bag must remain full and will ensure that the patient receives the highest possible concentration of oxygen. It is important that you inflate the reservoir bag before placing the mask on the patient's face. A full reservoir bag will ensure that the patient will receive the maximum concentration of oxygen directly from the reservoir with each breath. This is done by using your fingers to cover the one-way valve inside the mask between the mask and the reservoir. When placing the mask on the patient, you must take care to ensure that the proper seal with the patient's face. The reservoir must not deflate by more than 1/3 when the patient takes his or her deepest breath. You can maintain the volume in the bag by adjusting the oxygen flow on the regulator. The patient's exhaled air does not return to the reservoir. Instead, it is vented through a one-way flap or potholes on the mask. The minimum flow rate when using this mask is typically 10 liters per minute, but a high flow can be from 12 to 15 liters per minute and may be required to keep that reservoir bag filled. In picture A is an example of an adult nasal cannula, and in picture B is a nasal cannula properly placed on the face of that patient. Non-rebreather mask, you have the face mask, the one-way valve, and the reservoir bag. Make sure you inflate that bag before placing it on the patient's face, and always ensure adequate oxygen flow, and you can go up to 12 to 15 liters per minute. In picture A is an example of an adult non-rebreather mask, and in picture B is a non-rebreather properly placed on the face of the patient. A variation of the non-rebreather mask is the Venturi mask. The key to the Venturi mask is its adjustable jets that allow the user to more accurately determine the specific oxygen concentration delivered to the patient. The Venturi masks are more commonly seen and used in the hospital setting rather than pre-hospital. A blow-by device is another technique for the delivery of supplemental oxygen to a breathing patient. Is called the blow-by method. It can be used for any patient who will not tolerate having the traditional mask or nasal cannula placed on his or her face. With the blow-by technique, you can use the non-rebreather mask set to 15 liters per minute and simply have the patient hold the mask as close to the face as they are comfortable. This technique is especially good for small children who are typically frightened by the mask or the cannula. Be sure that the mask is held at as close to the face as possible to ensure a good supply of oxygen reaches them. In this section, we're going to talk about administering oxygen. Administration of oxygen to a non-breathing patient. There are 3 devices that are commonly used in EMS setting to provide high concentration of oxygen while providing rescue breaths for a non-breathing patient. They are the pocket mask with an oxygen inlet, the bag mask device, and the demand valve device. When using these devices, an appropriate airway adjunct should first be inserted. If you are allowed and trained to do so, always again follow your local protocols. So with that pocket mask with an oxygen inlet, the pocket mask is connected to an oxygen supply that can deliver high concentrations of oxygen than a pocket mask alone. Using oxygen supply tubing, connect the one end of the liter flow valve of the regulator and the other end to the oxygen inlet on the pocket mask. Turn on the liter flow to 10 liters per minute and use the mask as you normally would to provide rescue breaths. Next is the bag mask device. The bag mask device is an efficient tool for providing manual ventilation for a non-breathing patient or a patient who is breathing inadequately. It is best used with 2 rescuers. Most bag mask device can accept supplemental oxygen, however, it is not required. When available, you want to attach the bag mask to an oxygen source and adjust the flow to no less than 15 liters per minute. Many bag mask devices have oxygen reservoirs, which is the long tube or bag, to increase the oxygen concentration delivered to the patient. Used without a reservoir, it will deliver approximately 50% oxygen. Used with a reservoir, it will deliver an oxygen concentration of up to 100%. So you want to maintain that open airway, hold a tight mask to face seal, squeeze the bag to deliver oxygen, release the bag to allow for passive exhalation, and there is no need to remove that mask when the patient exhales. The bag mask can also be used to assist the breathing efforts of the patient who has inadequate respirations, especially in a drug overdose. Next is the demand valve device. A demand valve device delivers oxygen through a specialized regulator. That regulator can deliver 100% oxygen on demand, and that is when the patient inhales. The emergency medical responder can also activate the flow of oxygen by pressing a trigger on the device. Standard features of the demand valve device include a peak flow rate of 40 liters per minute, an inspiratory pressure relief valve that opens at approximately 60 of water pressure, and a trigger that enables the rescuer to use both hands to maintain that mask seal while activating that device. Here you will see that you need to remove that plastic wrapper or cap protecting that cylinder yoke. If you don't remove this, you will not be able to get to the holes to hook up the regulator to the tank. You then want to keep that plastic washer, as that is available in some setups. Next, you're going to quickly open the main valve for 1 second to remove any dust and then shutting it. You want to ensure that the O-ring is present on the regulator oxygen port. Then you want to place the regulator on the yoke and tighten the T-screw with only hand tight and do not over tighten. Then you want to attach the tubing from the delivery device that you will be using. And then explain the need of oxygen therapy to your patient. Next, you want to open that main valve 1 full turn, and then adjust the flow to the appropriate rate. Be sure to fill the reservoir bag prior to placing it on the patient by turning on the flow and placing your finger over the valve inside the mask. Position the oxygen delivery device on the patient. Secure the cylinder during transport. The pocket mask with the oxygen inlet delivers high concentration of oxygen than the pocket mask alone. With the bag mask device, it's capable of accepting supplemental oxygen, which works best when used by 2 rescuers. Here's an example of a typical pocket face mask with a one-way valve. Here's an example of an adult bag mask device connected to an oxygen supply. The demand valve device delivers oxygen through the regulator that can deliver 100% oxygen on demand when the patient inhales. You want to monitor the patient carefully when providing assisted ventilations. Many patients may benefit from supplemental oxygen. However, there are some patients where too much oxygen may be harmful. Be sure to consult with your local protocols to confirm the standard of care for providing oxygen in your system, area, or your region. Examples of situation where a patient may benefit from the supplemental oxygen include cardiac arrest during the resuscitation process, respiratory distress, heart attack depending on the oxygen saturation, shock, and allergic reaction. It is always important to explain to your patient what you are doing when providing care. Attempting to place a cannula or a mask on his or her face without explaining what you are doing first can be frightening for that patient. Once frightened, he or she may not have the trust in you or feel comfortable with what you are trying to do. Before placing the device on the patient's face, explain to them what you would like to provide as far as oxygen goes, and that it will help him or her feel better. Show the patient the device and explain how it will work and how it will fit on his or her face. At that time, gently place the device on the patient's face and confirm that he or she is comfortable with it, and adjust as necessary to make it comfortable. You then want to remind that patient to breathe as normally as possible. If your patient is anxious and seems reluctant to accept the device, provide that extra reassurance. In the case of a mask, allow him or her to hold that device and place it on themselves. This will allow the patient to remove the device if he or she feels the need. Sometimes the masks can make the patient feel claustrophobic. Monitor the patient closely and provide reassurance as necessary if his or her breathing does not improve. In this next section, we're going to talk about the summary of what we all learned. Most ill or injured patients will benefit from supplemental oxygen. Oxygen is stored and transported in portable containers called cylinders. Important to keep high-pressure cylinders lying flat on the ground to minimize damage. Cylinders should be stored in cool environment and away from source of flame or heat. Commonly used cylinders in EMS are the D, Jumbo D, and E cylinders. Pressure regulators used to reduce pressure of oxygen coming out of a cylinder. Two devices used to provide supplemental oxygen are nasal cannula, which can deliver oxygen concentrations up to 44%, and non-rebreather mask capable of delivering oxygen concentration up to approximately 90%. The amount of supplemental oxygen provided to the patient is determined by the mechanism of injury, signs and symptoms, and level of distress. When a patient is not breathing adequately, provide positive pressure ventilations. It can be performed by using the pocket mask, bag mask, and demand valve mask. Pulse oximeter is used to ensure oxygen saturation is above 94%.